Hello friends, you're watching Source of Health, the channel where we protect your well-being with science explained simply. I am Anvar and it's great to have you here. Today we're diving deep into a topic that's incredibly close to my heart: cardiovascular diseases. We'll explore their types, causes, natural treatments, and most importantly, prevention. Cardiovascular diseases are the leading cause of death globally, but up to 80% are preventable. My goal is to equip you with a clear, science-based roadmap to protect your heart. By the end of this video, you'll have practical, actionable strategies for everyday life. Let's get started on this journey to a healthier heart together. Let's kick things off with ischemic heart disease, or IHD. IHD means the heart muscle isn't getting enough blood due to narrowed or blocked coronary arteries. This narrowing is often caused by atherosclerosis, a build-up of fatty deposits and other substances forming plaque. Imagine a pipe slowly getting clogged with gunk over time. That's similar to what's happening in the arteries. When the heart muscle doesn't receive enough oxygen-rich blood, it can lead to chest pain or discomfort known as angina. Angina is often described as a pressure, squeezing, or pain in the chest, sometimes radiating to the shoulder, arm, back, neck, or jaw. If a plaque ruptures, a blood clot can form and completely block the artery, leading to a heart attack. A heart attack can cause permanent damage to the heart muscle. High levels of LDL cholesterol, high blood pressure, smoking, and diabetes are major risk factors for IHD. Many of these risk factors are modifiable, meaning we have the power to change them. Diagnosing IHD involves medical history, physical exams, and tests like ECG, stress tests, and coronary angiograms. Treatment goals are to relieve symptoms, improve blood flow, and prevent complications. Medications like statins, beta blockers, aspirin, and nitroglycerin are often used. In severe cases, procedures like angioplasty, stenting, or coronary artery bypass surgery may be necessary. A heart-healthy diet is paramount, incorporating fruits, vegetables, whole grains, lean proteins, and healthy fats. Regular physical activity, at least 150 minutes of moderate intensity exercise per week, is crucial. Quitting smoking is one of the most impactful things you can do for your heart health. Managing stress through mindfulness, meditation, or yoga can make a big difference. Understanding IHD is the first step towards taking control. By being aware of the risks, recognizing the symptoms, and adopting heart-healthy habits, you can significantly reduce your chances of developing IHD or manage it effectively if you already have it. Next up, let's talk about hypertension or high blood pressure. Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps it around your body. When this pressure is consistently too high, it's called hypertension. Hypertension is often called the silent killer because most people have no obvious symptoms. Regular blood pressure checks are crucial for everyone. Consistently high blood pressure puts a tremendous strain on your heart and arteries. Over time, this can cause the heart muscle to thicken and become less efficient, leading to heart failure. The constant high pressure can damage the delicate inner lining of the arteries, making them more prone to atherosclerosis. Untreated hypertension is a major risk factor for heart attacks, strokes, kidney disease, and vision loss. Diagnosing hypertension involves measuring your blood pressure regularly. Lifestyle changes are the first line of defense and can be incredibly effective. The DASH diet, which emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy products, is specifically designed to lower blood pressure. Reducing sodium intake and increasing potassium intake can help manage blood pressure. Regular physical activity, at least 150 minutes of moderate intensity exercise per week, is crucial. Maintaining a healthy weight, quitting smoking, and limiting alcohol consumption are also important. Managing stress through techniques like meditation, yoga, or spending time on hobbies can contribute to better blood pressure control. Managing hypertension is a lifelong commitment, but it's one that pays huge dividends in terms of your overall health and longevity. Now let's shift our focus to the brain and discuss stroke, which is essentially a brain attack. A stroke occurs when the blood supply to part of your brain is interrupted or severely reduced. There are two main types of stroke: ischemic and hemorrhagic. Ischemic stroke, the most common type, happens when a blood vessel supplying blood to the brain becomes blocked. Hemorrhagic stroke occurs when a blood vessel in the brain leaks or ruptures. The consequences of a stroke can be devastating, including paralysis, difficulty speaking, memory loss, and emotional disturbances. Recognizing the warning signs and acting fast is crucial. The acronym FAST stands for face drooping, arm weakness, speech difficulty, and time to call emergency services. High blood pressure is the single most important modifiable risk factor for stroke. Other risk factors include smoking, diabetes, high cholesterol, and atrial fibrillation. Diagnosing a stroke quickly is critical, involving neurological exams and imaging tests like CT scans or MRIs. For an ischemic stroke, treatment focuses on restoring blood flow to the brain as quickly as possible. For hemorrhagic strokes, treatment focuses on controlling the bleeding and reducing pressure on the brain. Prevention is the best strategy, involving managing high blood pressure, adopting a healthy diet, regular physical exercise, quitting smoking, and controlling diabetes. Rehabilitation after a stroke is a critical part of recovery, involving a team of specialists. The link between heart health and brain health is undeniable. By taking steps to protect your cardiovascular system, you are simultaneously taking vital steps to protect your brain from the potentially devastating impact of a stroke. Let's now turn our attention to heart arrhythmias, which are problems with the rate or rhythm of your heartbeat. An arrhythmia means your heart might beat too fast, tachycardia, too slow, bradycardia, or with an irregular pattern. A normal, regular heartbeat is essential for the heart to pump blood effectively to the rest of your body. There are many different types of arrhythmias, with atrial fibrillation, AFib, being one of the most common. Symptoms can vary widely, including palpitations, dizziness, lightheadedness, shortness of breath, and chest pain. Arrhythmias can be triggered by coronary artery disease, high blood pressure, heart valve problems, thyroid issues, and electrolyte imbalances. Diagnosing an arrhythmia involves reviewing symptoms, medical history, and conducting tests like ECGs and Holter monitors. Treatment depends on the type and severity of the arrhythmia. Medications like beta blockers, calcium channel blockers, and antiarrhythmic drugs can be used. Procedures like cardioversion, catheter ablation, and pacemaker implantation may be necessary. Maintaining a heart-healthy lifestyle is fundamental for managing arrhythmias. Managing underlying conditions, stress reduction techniques, and being mindful of stimulants like caffeine and alcohol are important. Ensuring adequate levels of electrolytes through a balanced diet can also be helpful. If you experience symptoms like palpitations or dizziness, it's important to see your doctor. Early detection and appropriate management are key to living well with an arrhythmia. Our final chapter focuses on heart failure, a condition where the heart muscle isn't able to pump blood as well as it should. Heart failure can manifest as systolic heart failure, HFrEF, or diastolic heart failure, HFpEF. Common symptoms include shortness of breath, fatigue, swelling, rapid or irregular heartbeat, and persistent cough. Heart failure is often the result of other conditions that have damaged or overworked the heart muscle over time. Diagnosing heart failure involves medical history, physical exams, echocardiograms, ECGs, chest x-rays, and blood tests. Medications like ACE inhibitors, beta blockers, diuretics, and newer medications like ARNIS and SGLT2 inhibitors are used to manage heart failure. Lifestyle modifications are critical, including dietary changes, regular physical activity, maintaining a healthy weight, quitting smoking, and managing stress. Medical devices like pacemakers and ICDs may be recommended in some cases. Living with heart failure requires ongoing management and a strong partnership with your healthcare team. While there's no cure for most types of heart failure, many people can live full and active lives with proper management. So to sum up our journey today, cardiovascular diseases in their many forms are indeed serious conditions that affect millions of lives. We've covered a lot, from the narrowed arteries of IHD and the silent strain of hypertension to the urgent crisis of a stroke, the erratic rhythms of arrhythmias and the challenged pump in heart failure. But the overwhelming message I want you to take away is one of hope and empowerment. The solutions and preventive measures are often simple, rooted in consistent, positive lifestyle choices. They are based on solid science and can genuinely change your life and the lives of those you care about.